Hi, today we are talking about the documentation needed for suicidal thoughts or a suicide risk assessment. So this is very, very important. So this is, this could, in worst case scenario, come back at you legally. So you want to make sure that you're not only doing right by the client and doing everything you can to protect them, but you also want to make sure you're protecting yourself as well. And that's where the documentation comes in. So, and remember with documentation, the famous quote is, if it's not documented, it didn't happen. So if it's not documented and, somebody later, police or a family member of somebody who, completed suicide comes back and wants to question you and find out what happened, and see if maybe you're liable somehow, then you can't say, well, I did this suicide risk assessment, I did a suicide prevention plan with them, but if it's not documented and there's no evidence of that, and it really basically to everybody else, it never happened. Okay, so this is extremely important. So for documentation, do not document suicidal ideation without doing a suicide risk assessment and a follow-up plan, right? Once you document that ideation, you have to follow it up with an assessment, a suicide risk assessment, and a plan moving forward to continually assess their risk. We'll go into that further. Okay, so for the assessment section of the SOAP note, the intervention all of a sudden turns into, it's no longer, CBT or motivational interviewing or something like that. It turns into crisis intervention and a suicide risk assessment. So make sure you have in there in your assessment section, crisis intervention and suicide risk assessment as the interventions and how they, responded to those interventions. And then you'll go into, the outcome of the risk assessment and the follow-up plan. So you also need to put in there that you did remind the client of your limits of confidentiality, right? Actually, that's not, if you don't subscribe to that, you don't believe that you need to warn them, then I guess there's no need to put that in there. But I put that in there because I've seen situations where the client come back and, accuse you of breaking confidentiality with not enough evidence to do so, or that you didn't look out for their best interest and did them more harm than good by reporting them or something like that. And believe me, I'm gonna go on another, little tangential thought, but all you need is something to be reported for it to be a nightmare for you. So I try to avoid anything that could, potentially do any of that at all costs. So I try to document everything I possibly did. And you know what? We should, because we did it. We did our due diligence. So we would be selling ourselves short if we didn't document that. So it's always a good thing to document everything that you did, especially when you did it right. Okay, next you're going to document the risk factor level, whether it was minimal, moderate, mild, moderate, high, and sometimes we'll use a mild to moderate, moderate to severe, something like that. But you want to document the outcome of your risk assessment, and then what did you do in response to this risk assessment, right? We're already doing it, we want to document it. So, and then you want to also document that you did a suicide prevention plan, even if it was minimal. Put together, it maybe doesn't have to be, as lengthy, as intense, as involved, but you want to put together some semblance of a suicide prevention plan. Then you want to try to document future orientation, right? Future orientation is anything that the client is talking about that would be in the future, right? This is a mitigating protective factor for the client and for us, right? So especially if we're not reporting it right? So if we're not reporting it, this is even more important, because we're saying, okay, they expressed suicidal ideation, but it wasn't, basically it doesn't appear that they're going to attempt suicide. So it's not reportable. So we need to definitely document even more so why we found it not to be reportable. And so future orientation can help us a lot. So this could be that they agreed to a follow-up appointment next week. They gave me, it could be any plans for the future, anything that they're looking forward to. And I quote them. If they're like, okay, I'll see you next week, or, I'm going to be fine for, I know I'm going to be fine. I would never do anything, I would never do anything like that also. So that's not necessarily future orientation. That would also be like just, you want to also quote anything they say, that if they're saying like they would never do something like that, or I would never do that to my parents or my children, or anything like that, or so that would be a little separate, but that still is important. But with the future orientation, anything that shows that it's a plan for the future, or something that they're looking forward to, even if it's later that night, oh, I have dinner plans. And that's something you can even help the client set up. Hey, is there anybody that you can be with tonight? So you don't have to be alone. Who's at the house? What can you do? Can you maybe make, can you, plan to go out to dinner, or make a special dinner? Or can you watch a movie together, or something like that? Call a friend, a family member, and then you want to document that. So, and then on all follow-up notes, you must include just a brief assessment. And you want to, at least at a minimum, if in the follow-ups they're denying any, it was like a one-time deal and they were just having a really bad day, and now the rest of the sessions they're denying any sort of ideation, all you have to do is put denied SI intent plan. That's it, and you're done, right? But if they report suicidal ideation with no intent or plan, you need to write that, right? So you can put reported SI, denied intent plan, right? And then you would review the suicide prevention plan with them, and document that you reviewed the plan with them, okay? And then again, including as many quotes as you can. So hopefully that helps. Document, or it didn't happen.